As we head towards the end of the year and as our numbers continue to spike,
the surge of COVID-19 in our community and the nation is quite scary, and UCSC has really acted as a backstop to our community in providing additional testing resources.
And so this has been a really big benefit for our community because it alleviates a lot of pressure on the rest of the healthcare system.
One of the key design features that we've had in place with the lab is the ability to handle surges within the community and be able to help our partners on campus and off campus.
And we're extremely fortunate to be able to have their capacity for testing, which has helped us meet our goals throughout COVID-19 and allowed us to open up during periods when we normally would have been shut down.
UCSC has become an integral part of how our community responds to COVID-19.
We've been fortunate to have an incredible partnership between UC Santa Cruz, the safety net medical providers, and the Santa Cruz Community Foundation, who has stepped in to provide the financial support for testing for the safety net providers.
Salud para la Gente and Santa Cruz Community Health are led by Leslie Connor and Dory Rose Inda. Both women have told me that having these tests available have changed the way their staff and their patients feel. They feel safe, they feel empowered, in charge of their health, and able to make wise decisions.
The lab is being renamed the Bud and Rebecca Culligan Clinical Diagnostic Laboratory. Through their generous support, we're going to be able to expand the capacity of the lab to handle additional surges within the Santa Cruz community.
We wanted to make sure that testing resources were available to those that are most vulnerable in our community, and that's why investing in the clinical diagnostic lab was important to us.
This is our community. This is our home. We want to help the community.
For our community partners, we've been able to grow to doing routinely 1,000 tests a day with the ability of increasing even higher to 1,500 to 2,000 tests per day in the coming months. Once we curtail COVID-19 testing, the laboratory will transition to a pediatric genomics lab.
It's really critical that this kind of research happens because it's really going to transform how we address disease and the speed at which we can address disease in the future. And so the notion that this clinical laboratory really will have two purposes. One, to address the immediate need around COVID-19, and then bridging to the research and diagnostic work for pediatric cancers is, for us, the best of both worlds.